matter what mitigation measures we implement at the state level, if there's not support, collaboration, and partnership at the local level, it will not make a difference.
You're outside people who live in your own house. You need to be careful.
You must cancel the normal Thanksgiving plans.
Health and government leaders across the Midwest urging caution and cooperation as we enter the holiday season. Good evening, everyone. I'm Linda Jackson. My partner Tom Powell has the night off. The state of Indiana not just breaking but shattering records when it comes to the number of COVID-19 cases reported in a single day. The Indiana State Department of Health confirmed more than 6,600 cases today. That's nearly 1,500 more than yesterday's record-setting total. Looking back to early October, that number 1,500 would have set the daily case record on its own back then. The virus did also claim the lives of 51 more Hoosiers, increasing the state death toll to 4,563. Focusing on Allen County, we didn't top yesterday's record, but health officials did report another 400 new local cases of COVID-19, and 11 Allen County residents died, which sadly takes the local death toll to 261 this evening. Allen County's health commissioner says because of the skyrocketing numbers, he is considering implementing tighter restrictions locally. Fort Wayne's NBC reporter Corinne Rose talked with him during a Zoom meeting this afternoon.
I think there's a lot of things in the governor's plan, and there's some additional things we can do to help stop the spread of this virus in our community.
Speaking to us through a spotty internet connection, Allen County Health Commissioner Dr. Matthew Sutter says he applauds the governor's announcement of a new executive order. He says after he sees the text of it, he will likely impose even tighter restrictions in Allen County.
Based on what we've seen through our local contact tracing, we are seeing transmission in bars and restaurants. I do think it makes sense to have reduced capacity in both of those to allow for 6-foot social distancing.
He says outbreaks are also happening at social gatherings and says he may limit the number of people allowed at those to fewer than the 50 set by the governor.
Many people are still not taking this seriously, and most of the spread we're seeing is actually in small family gatherings, social gatherings, birthday parties, and weddings. That needs to change.
If it doesn't, there could be enormous ramifications. Wednesday, we reported that out of our 11-county area in northeast Indiana, only 48 ICU beds were available for any patient who needed them. Now, our region only has 42 ICU beds available, and Dr. Sutter is very concerned about what he calls the significant strain on our hospital systems.
I'm concerned that the real problem with this will not be the number of ventilators or the number of ICU beds, but really the personnel to take care of sick patients. Already, both hospital systems are seeing large numbers of people both ill with COVID-19 and on quarantine because of exposures. That's limiting their ability to provide the best care.
He says if coronavirus numbers continue to climb, local hospitals may have to cancel elective surgeries to meet the demand. Dr. Sutter expects the governor's order to come out Friday and says any new local restrictions from him could come in the next week. Corinne Rose, Fort Wayne's NBC.
Now, if you test positive for COVID-19, your employer may say it requires you to get another COVID test with a negative result before you can return to work. Dr. Sutter says the CDC actually advises people should not get multiple tests and says you should refer your boss to the CDC's website for back-to-work guidelines.